I'm curious to know if we can start putting funds towards the ICU renovation pot and doing a countdown like we did for the new one.
Yeah, that's a very good question. So thank you for asking. It means that our staff are interested in how things work behind the scenes. So just to give a bit of a context, you are correct. Any donation that we get that has a specific purpose identified by the donor, you call it a restricted fund. So that has to be spent the way the donor had intended for it to be. Any donation that has no particular purpose, it goes to what we call like a general pocket fund. And what we do typically is that twice a year, we ask the departments through your managers, what are your capital equipment needs? And then we identify which one is the highest need or the highest risk. And then we are the ones responsible for proposing to the foundation board and for the foundation board to approve those requests. Now, for the EDICU question, which is a great question, which is why I have Cassie here, so she can answer that for you.
So what's happening now is that the foundation, working with the hospital, the way George just described, is that we have a goal of $400,000 to $500,000 in fundraising just for the capital needs that are recurring every year, even just simple things like the amount of beds that need to be replaced at each site. And then what we're trying to do is looking forward. So we've actually been in what's called a quiet planning phase for the EDICU project for 2 years now. And so there will be more information be released. There's a very strategic process, but and that's to protect the strength of the fundraising and when that campaign does go live. But we are basically essentially anything that isn't needed through restricted funds, or once everything's covered for the yearly priority, that money is being put aside towards the EDICU already. So that, to answer your question, is actually happening, and there will be more information coming out soon. Probably, when I say soon, I should probably adjust that to be 2027 will be going more public because we have some major work that we have to have established in the background before we go live with public announcement of the campaign.
And to wrap up the answers to your question, we always encourage all of you, if you have any projects or any equipment that you're identifying as something that would improve the care for the hospital's patients, then please let us know because we would love to hear your ideas. And through the foundation's help, we're hoping to be able to support and fund those initiatives so that it could propel the organization to a much better, higher quality of care. So thank you so much.